Welcome to our video on Trulicity. Whether you've recently been prescribed this medication or are simply curious about its uses and potential side effects, you've come to the right place. In this comprehensive guide, we'll delve into the common uses, benefits, potential adverse reactions, dosage, and risks associated with Trulicity. Common uses of Trulicity. Trulicity is primarily prescribed for individuals with type 2 diabetes. It belongs to the class of medications known as glucagon-like peptide-1 receptor agonists, GLP-1RAs. The main purpose of Trulicity is to help manage blood sugar levels in these individuals. It works by stimulating the release of insulin and reducing the production of glucagon, a hormone that raises blood glucose levels. Additionally, Trulicity may be prescribed alongside other diabetes medications, such as metformin, to further enhance blood sugar control. It is important to note that Trulicity is not approved for use in individuals with type 1 diabetes or diabetic ketoacidosis. Benefits of using Trulicity. One of the key benefits of Trulicity is its ability to help individuals with type 2 diabetes achieve and maintain better blood sugar control. By lowering blood glucose levels, Trulicity can help prevent or reduce the risk of diabetic complications, such as kidney disease, nerve damage, and eye problems. In addition to its effects on blood sugar management, Trulicity has also been associated with potential weight loss. This can be particularly beneficial for individuals with type 2 diabetes who are overweight or obese, as weight loss can improve insulin sensitivity and overall metabolic health. Furthermore, research has shown that Trulicity may have cardiovascular benefits. In clinical trials, Trulicity has been found to reduce the risk of major adverse cardiovascular events, such as heart attack or stroke, in individuals with type 2 diabetes who have established cardiovascular disease or multiple cardiovascular risk factors. Potential adverse reactions of Trulicity. Like any medication, Trulicity comes with potential adverse reactions that need to be considered. The most common side effects reported by individuals taking Trulicity include nausea, vomiting, diarrhea, and decreased appetite. These gastrointestinal side effects usually occur during the first few weeks of treatment and may improve over time. It is important to be aware that Trulicity can also cause more serious adverse reactions, although these are rare. Some individuals may experience severe allergic reactions, including swelling of the face, lips, tongue, or throat, difficulty breathing, or skin rash. Other rare but potentially serious side effects include pancreatitis, kidney problems, and an increased risk of thyroid cancer. If you experience any concerning or persistent side effects while taking Trulicity, it is important to contact your healthcare provider immediately. They can assess the severity of your symptoms and determine the best course of action. Dosage guidelines for Trulicity. Trulicity is available as a pre-filled pen that is injected subcutaneously under the skin once a week. The recommended starting dose is 0.75 mg, which can be increased to 1.5 mg if additional blood sugar control is needed. The injections can be administered at any time of the day with or without meals. It is important to follow your healthcare provider's instructions regarding the dosage and administration of Trulicity. They will consider various factors such as your blood sugar levels, overall health, and response to the medication when determining the appropriate dose for you. Risks and precautions associated with Trulicity. While Trulicity can be an effective medication for managing type 2 diabetes, there are certain risks and precautions that need to be considered. For instance, individuals with a history of pancreatitis or a family history of medullary thyroid carcinoma, MTC, should use Trulicity with caution, as the medication may increase the risk of these conditions. It is important to disclose your full medical history to your healthcare provider before starting Trulicity. They can assess your individual risk factors and determine whether Trulicity is a suitable treatment option for you. Additionally, Trulicity may interact with other medications, such as insulin or certain oral diabetes medications. Your healthcare provider should be aware of all the medications you are taking to ensure there are no potential drug interactions. Trulicity versus other diabetes medications. Trulicity belongs to the class of GLP-1RAs, which includes other medications such as Byetta and Victoza. While these medications share similarities in their mechanism of action, there are some differences that may influence the choice of medication for individuals with type 2 diabetes. For example, Trulicity is a once-weekly injection, whereas other GLP-1RAs may require daily or twice-daily injections. This can be a significant factor for individuals who prefer the convenience of less frequent dosing. Additionally, Trulicity has been specifically studied in individuals with established cardiovascular disease or multiple cardiovascular risk factors and has demonstrated cardiovascular benefits. This may make it a preferred choice for individuals with type 2 diabetes who have a higher risk of cardiovascular complications. Ultimately, the choice between Trulicity and other diabetes medications should be made in consultation with your healthcare provider, taking into consideration your individual needs, preferences, and medical history. Trulicity and weight loss. Weight loss is a common goal for many individuals with type 2 diabetes, as it can improve insulin sensitivity and blood sugar control. Trulicity has been associated with potential weight loss, although the extent of weight loss may vary between individuals. In clinical trials, individuals taking Trulicity experienced modest weight loss compared to those on a placebo. The exact mechanism behind this weight loss is not fully understood, but it is believed to be related to Trulicity's effects on appetite regulation and delayed gastric emptying. It is important to note that weight loss with Trulicity may not be significant for everyone, and individual results may vary. Lifestyle factors such as diet and exercise also play a crucial role in achieving and maintaining weight loss. Trulicity cost and insurance coverage. The cost of Trulicity can vary depending on factors such as your location, dosage, and insurance coverage. Without insurance, Trulicity can be quite expensive. However, many insurance plans, including Medicare and Medicaid, cover Trulicity to some extent. If you are concerned about the cost of Trulicity, it is advisable to contact your insurance provider to understand your coverage options. Additionally, pharmaceutical companies often offer patient assistance programs or savings cards that can help reduce the out-of-pocket cost of Trulicity. It is important to discuss any financial concerns with your healthcare provider. They may be able to provide guidance or suggest alternative medications that are more affordable. Conclusion and final thoughts. Trulicity is a medication commonly prescribed for individuals with type 2 diabetes. It helps manage blood sugar levels by stimulating insulin release and reducing glucagon production. Trulicity offers benefits such as improved blood sugar control, potential weight loss, and reduced risk of cardiovascular events. However, it is important to be aware of potential adverse reactions and risks associated with Trulicity. Common side effects include gastrointestinal symptoms, while rare but serious side effects can occur. It is crucial to follow dosage guidelines and discuss any concerns with your healthcare provider. Trulicity may be a suitable option for individuals with type 2 diabetes who require additional blood sugar control or are at higher risk of cardiovascular complications. However, individual preferences, medical history, and cost considerations should be taken into account when making treatment decisions. Remember, this video is meant to provide general information and should not replace personalized medical advice. Always consult with your healthcare provider for guidance specific to your situation.